Okay, so the next skill that I'm going to show you guys is how to provide catheter care to a patient. Okay, so the catheter is already going to be inserted in your patient, and the balloon at the tip of the catheter should be blown up for you. Okay, do not pull the catheter out. That is an automatic fail. So just make sure that you don't do that. Okay, the numbers for this one, when it comes to linens, is going to be 42. 4 washcloths, 2 towels. So here we go. All right, we're going to knock in. Good morning, Mrs. Jones. How are we doing today? She says that she's doing fine. My name is Michael, and I'm going to be your CNA today. And is it okay if I provide some catheter care on you? She says that that's fine. So now I'm going to go ahead and close her curtain for privacy. Okay. I'm then going to perform hand hygiene. And first thing I'm grabbing is my chucks. Okay, you've got to have a clean surface area to put all your stuff down. Alright, then I'm going to get my linens. So 42, 4 washcloths, and 2 towels. 1, 2, 3, and 4. And then I've got 2 towels. Okay, got that all set. So we're just going to need our soap. Okay, we are going to need a pair of gloves. So again, make sure that you choose the appropriate pair. You don't want to get caught and try to put smaller gloves on. And we're also going to need our basin. Okay, so we're going to go ahead and fill up our basin about halfway with lukewarm water. Okay, I'm going to test the temperature, and then the patient has to test the temperature. Okay, so she's going to test it. She says it feels just fine. Okay, so now my washcloths, they're going to get wet, so they need to go in the water. Okay, and now I'm going to glove up here. Okay, because now we're getting ready to actually get into the skill, and you want to make sure the gloves are on. Okay, now there is a reason why I grabbed 2 towels, and you'll see in just a second here, because we're not going to need 2 towels for drying. Okay, so now our gloves are on. So, Ms. Jones, I'm just going to go ahead and uncover you a little bit, okay? So, covers go down, gown goes up, okay? And that'll show the catheter, okay? Now, Mrs. Jones, I'm just going to ask you to open your legs if you would, please. Okay, so the patient is going to open their legs. All right, so for this second towel here, okay, the second towel is going to go basically where the chuck would be, okay? This is to keep her bed area dry, okay? So what I recommend doing is taking the catheter, holding it, okay, and just gently moving it out of the way. So you can take your towel about half folded, and you're just going to tuck it underneath your patient's buttocks area and the thigh area, okay? This is going to keep everything nice and dry. Okay. Hopefully the camera can see that. And then I'm just going to hold the catheter and replace it right back where it needs to be. Okay? So, now we've got our washcloth here. We're going to add soap to it. Okay, and we're going to lather up. And this is where you're going to switch sides. Okay? So you only have to do 4 for this one. Okay? So it's going to be 1, then 2 right next to the catheter, okay? Then 3 next to the catheter again, and then 4. So you actually don't have to do the thigh or groin areas for this skill, okay? So just remember that. And always hold the catheter, okay? So first swipe, front to back, okay? And then we're going to peel. Second swipe, it's right next to the catheter, and peel. Third swipe, peel, and then 4th swipe. Okay? So again, that is your soap. Make sure that you walk your washcloth over to your hamper. And we're just going to repeat the same steps, but this is just rinse. Okay? And notice how I'm holding the catheter about an inch or so outside of the body. You do not want to be right up where it enters the patient's body. That will cause pain. Okay, so first swipe, all right, then second swipe, then third swipe right next to the catheter, and then fourth swipe. Okay? Again, take this to the hamper. And now this second towel right here, or this first towel rather, is going to be your drying towel. Okay? Again, hold. And you're just going to kind of spot dry a little bit. Okay? Again, to keep infection at a minimum, make sure that you turn over to a new side on your towel. And now we're going to add soap to this next washcloth. And we are going to do the catheter. Okay? Now the catheter, you're going to want to go ahead and you're going to want to start cleaning about where your fingers are up at the top here. And you're going to wipe all the way down to the connectors. Okay? So here we go. So that's one. Okay? And you're just doing 4 swipes. So 2. This will be my third one. And this will be my 4th one. Okay? So now that's soap. So I just have to repeat with the rinse and then dryer. Okay? So here we go again. This will be 4 swipes. 1, 2, 3, and 4. Okay, and then we just have to dry. Okay, holding the catheter, you just want to lightly dry it off. Okay, it shouldn't be super soaked anyways. You're going to go ahead and put that towel in the hamper. Now this is where it is important. You need to hold on to the catheter because you are going to pull this towel out. And you do not want to have it pull out on you because it is an automatic fail. So holding the catheter, that costs nothing. Okay? So now Miss Jones, we're just going to have you close your legs. Okay? Gown comes down, sheet comes up. Now the patient should be nice and comfortable. Okay? And now you're going to go ahead and take your supplies and put them away. So again, test only states that you have to rinse this out minimum of 2 times. I like to do 3. All right, 1, 2, and 3. I get my paper towels, dry this out, place it back in my bin, throw out my chucks in the trash, and now my gloves. Okay, again, taking gloves off, you can just pull from the palm down to the floor. Okay, 1 glove goes inside out. Your second one pretty much eats the first glove. 2 fingers. And you actually create yourself a little baggie, okay, for your gloves. So Mrs. Jones, is there anything else I can do for you? She says, nope, there's nothing else. So I'm just going to go ahead and give the call light to her hand. Okay. And again, if your mannequin